Assalamu alaikum. I'm Dr. Marfia Anjumand, lecturer, Department of Biochemistry, Bashundhara Ad-din Medical College. Today, I am going to discuss an important topic of clinical biochemistry, that is lipid profile and dyslipidemia. Now, what is the definition of dyslipidemia? Dyslipidemia, group of metabolic disorders characterized by abnormal plasma lipoprotein and lipid concentration. Here, abnormal means high or low. Now, come to the classification of dyslipidemia. Dyslipidemia may be classified into 4 categories. They are primary hyperlipidemia, primary hypolipidemia, secondary hyperlipidemia, secondary hypolipidemia. Now, come to the first one, primary hyperlipidemia. It is mostly idiopathic, that means cause is unknown. It includes familial hyperchylomicronemia, familial hypercholesterolemia, familial combined hyperlipidemia, familial hypertriglyceridemia. Now, primary hypolipidemia. It is mostly idiopathic. It includes primary hypo-alpha proteinemia, hypo-beta lipoproteinemia. Now, come to the secondary hyperlipidemia. It is due to nutritional factor, for example, excess calories in diet, excess consumption of saturated fat or cholesterol. Hepatic diseases, example, hepatitis, obesity, alcohol abuse. Renal disease, example, CKD. Endocrine disorder, example, hypothyroidism. Drug, steroid, oral contraceptive pill. Now, come to the secondary hypolipidemia. It is due to chronic cachexia, example, malignancy, chronic malabsorption. Now, come to the clinical importance of dyslipidemia. Atherosclerosis, for example, coronary artery disease, cerebrovascular disease, peripheral vascular disease, fatty liver disease and acute pancreatitis. Today, we will also discuss lipid profile. So, what are the components of lipid profile? Serum total cholesterol, serum LDL cholesterol, serum HDL cholesterol, serum triacylglycerol. Now, come to the clinical importance of lipid profile. Diagnosis of dyslipidemia, assessment of prognosis for a known dyslipidemia patient, assessment of risk for atherosclerosis and coronary artery disease. Sample needed, mostly serum, plasma. Now, come to the preparation for lipid profile test. At least 10 to 12 hours fasting. Usually, overnight fasting is advised. Usual diet at before 3 days. Usual activities in previous 3 days. Individual must be free from trauma, surgery, acute infection and pregnancy. Now, come to the procedure for lipid profile test. After overnight fasting blood sample is collected in the next morning in a plain test tube and allowed to clot. Serum is separated, components are measured. Now, lipid profile and their interpretation. So, components are serum, total cholesterol, our desired level is less than 200 milligram %. Serum LDL cholesterol less than 130 milligram %. Serum triacyl glycerol less than 150 milligram %. Serum HDL cholesterol greater than 400 milligram %.